What will federal healthcare reform mean to you as a city employee? For the past several years, there has been a lot of discussion at the national level about healthcare reform and new regulations meant to expand healthcare coverage to all Americans. Have you been able to make sense of it all?
I have to be honest, I'm not very well informed on this issue.
One thing I know is there's a lot of ambiguity around it.
Honestly, I don't know much about it.
Most people who are suffering who don't have health care need access to some sort of good, accessible health care.
Another layer of bureaucracy.
I think it's kind of a, gray area on health insurance.
They just haven't explained it all, and I think the American people have no idea of what's in that bill.
Basically, everyone would be covered for free.
The employer or the individual has to pay some kind of tax, I believe.
Poor people can get health care. That's basically all I know about it. I don't know the intricate details about it. So,
as you heard, there are a lot of ideas as to what healthcare reform means. It is our hope that the information presented in this video will help you have a better understanding of how federal healthcare law may impact you. As we will discuss, due to changes in federal regulations, there are some additional healthcare insurance options for you to consider this fall during open enrollment. For the majority of you who currently receive healthcare coverage from the City of Boulder or a spouse's employer plan, we anticipate that this may continue to be your most affordable option. However, the City and your Human Resources Department want to keep you informed of all of the new options available so that you can make the best decision when the time comes. So let's begin. Today, in 2013, when it comes to healthcare insurance, you essentially have one of two choices. Enroll in one of the city's plans if you are eligible, or opt out of the city's plans due to other coverage you are receiving through a spouse or partner's plan, a parent's plan, military coverage, Medicare or Medicaid. Because of the new healthcare reform law in 2014, all Americans will be required to have some form of health insurance, with very few exceptions. To help accomplish this, we will all have additional options to consider when it comes to healthcare in 2014. It's important to understand these choices, evaluate them, and make an informed decision during the city's benefits open enrollment later this year. While we will provide you with more detailed information on these choices in the coming months, here is an overview of your 2014 healthcare coverage options. The first two choices will remain the same. The third option to consider is Medicaid. Colorado is one of a number of states that has chosen to expand eligibility for its Medicaid program. This means more people will become eligible for this program. Medicaid requires no monthly charges or premiums to those who qualify, and there is little to no cost at the time of care. If you qualify for Medicaid based upon your household income, which is earnings of approximately $15,500 or less for a single-person household, and $32,000 or less for a family, we strongly recommend that you take advantage of this option. The fourth option is to enroll in the Colorado State Healthcare Exchange. As you can see on this map, Colorado is one of 17 states that has created a state healthcare exchange, or marketplace. This state exchange is a marketplace where you can purchase health insurance. Carriers who participate in the marketplace will be required to offer standard plan designs. These plans have been named Bronze, Bronze Plus, Silver, Gold, and Platinum. Bronze plans will have the lowest premium cost and the most out-of-pocket expenses in the form of deductibles, co-insurance, and copays. Platinum plans, on the other hand, will likely be similar to HMOs, with low or no deductibles and attractive copays. This means the Platinum plans will have the highest premium cost. All city employees have the option of coverage on the state exchange or marketplace. However, for the majority of you, it will be more financially feasible to remain on the city's coverage, or that of a spouse or parent. For those employees who are not eligible for the city's healthcare plans, or for those who are not offered affordable city coverage as defined by the law, a federal subsidy may be available to help make health plans on the marketplace more affordable for you. We encourage you to evaluate the plan designs and carrier choices offered in this new marketplace. Some may work better for you. A final choice is to have no insurance. While technically this is an option, new tax penalties will apply if you are uninsured. The penalty is fairly small in 2014, but it will grow quickly over the next few years. Now that you know your options for healthcare insurance in 2014, let's spend a moment touching on other impacts the new law may have. There will be new plan design and cost-sharing requirements, new fees, and policy considerations for part-time, temporary, and seasonal employees. We'll discuss the plan impacts first. The new law defined a number of plan design and cost-sharing requirements that begin in 2014. We're pleased to tell you that the city plans and premium cost-sharing arrangements are already compliant with all of these requirements. So let's talk about the cost impacts. There are 3 new fees as part of the reform legislation. These fees will be used to start the funding of the federal subsidies, ensure the marketplace against any high-risk individuals who will now be gaining coverage, and fund government research on the quality of healthcare services in our nation. These fees have an impact on our health insurance premium rates at the city for 2014. The city will pay a majority of these fees, however, you will pay a portion through your contribution toward the plan premium. Finally, from a policy perspective, the city is currently reviewing an element of the law that may have some additional impacts in the future. For the first time ever, the federal government has defined what it means to be a full-time employee eligible for an employer's health care plan. Beginning in 2015, anyone working 30 or more hours per week will be considered a full-time employee. While this component has been delayed until 2015, we're continuing to explore it now. Standard employees who work 20 to 29 hours, temporary, and seasonal employees should stay tuned for more information to come on this piece of healthcare reform. We hope this information has provided you with some helpful insights into the potential impact of federal healthcare reform on an individual level. We understand there is a lot to consider, and we will be here to support you in exploring your options during benefits open enrollment. The 2014 Benefits Guide on the Benefits webpage has been updated to include information on healthcare reform and the Colorado State Exchange. Implementation details of the law are still evolving. We encourage you to explore the Benefits website for the most up-to-date information as it becomes available. If you have any questions in the meantime, please feel free to contact your HR manager or Suzanne Coleman, the Benefits Manager.